To start, I want to affirm that my administration is monitoring the situation at the 11 Illinois long-term care facilities owned by Infinity Healthcare to ensure that services for our most vulnerable residents continues uninterrupted. There are hundreds of SEIU nursing home workers on strike who are asking for the same type of reasonable working conditions that a large number of long-term care facilities around Illinois have already agreed to in their own contracts. And given the significant federal and state financial support for nursing homes during this pandemic, it's important that workers see that funding reflected in their that they see that funding reflected in their workplace, in their safety and their pay. It's very important to me that the owner and the unions are able to sit down and negotiate quickly and in good faith so that they can get back to work and to the work that matters the most, which is getting our residents safely through this pandemic. So on to our regular COVID update. Just as has been the case throughout this pandemic, the new COVID-19 diagnoses of today were a result of actions people took days, even a week or more ago. The new COVID hospitalizations of today were people who were first exposed 1 or 2 or sometimes even 3 weeks ago. And those who passed away due to COVID-19 today may have been fighting in the hospital for days or weeks or possibly even longer. All that is to say that we know that we aren't going to see the bulk of the impact from Thanksgiving in our data quite yet, just as it took time to see the impact of the 4th of July and Labor Day celebrations in the data. Additionally, past experience has taught us that decisions about whether to get tested are much different around the holidays. As expected, we saw peak demand here in Illinois running up to Thanksgiving, followed up by a significant drop-off. As you could imagine, that leads to more uncertainty in the trends that we're seeing in this in-between period. Today's uptick in our positivity rate could be from exposures beginning perhaps 2 weeks ago and including exposures that may have occurred at Thanksgiving, or it could be attributable to these fluctuations in testing. Yet another reason that we need to give ourselves time to monitor changes as behaviors begin to normalize. Again, people returned now from Thanksgiving. What I am certain of is that this virus is circulating widely in every county across the state of Illinois. And if you are exposed to the virus and become infected, you will be infectious before you're aware that you have this disease. That means if you didn't socially distance at Thanksgiving and you spent time with people who are not in your own family bubble, you may feel fine right now, but you could nevertheless be passing COVID-19 onto others without knowing it. So for anyone who traveled or gathered with family and friends for the Thanksgiving holiday, monitor yourself for symptoms. And if you have any of those symptoms, stay home. Even if you think you are having allergies or experiencing what feels like a mild cold, IDPH recommends that you stay home as much as possible and avoid close contact with other people, and that includes those in your own household. If you didn't travel for the holiday, now is not the time to go have an in-person visit with your friend who did. For those who traveled for Thanksgiving, IDPH recommends that you get tested between 5 and 7 days after your return. So that's tomorrow, Thursday, or Friday. That's only if you're asymptomatic and you want to go get a test. If you have symptoms, you should get tested right away. This is the time to be extra careful. With a surge of the virus expected, limit your mobility outside your home and stay home if you don't feel well. Even if you feel well, Other than leaving for work or for school or for essential trips like going to the grocery store, these next few weeks are a time to stay home as much as possible. Assume you were exposed, and assume more of your coworkers or friends were exposed than ever before, and act like it with social distancing, wearing your mask whenever you're in public, whenever you're with other people. It's the safest thing that you can do for the people that you love and for the healthcare workers who risk their lives to help you when you need them. When Dr. Ezike stands up and provides these updates each day, you'll often hear her add, these are more than numbers. She's right. She says these are people, mothers, fathers, siblings, children, friends. COVID-19 has stolen so many lives that weren't ready to be taken. That's the curse of this disease. And it's a curse made incredibly more painful when it rains down upon so many families all at once. Our next speaker knows that pain all too well. Mrs. Shauna Seegers of Stager, Illinois, her husband Otis, and their son were 3 of the thousands of Illinoisans to become infected with COVID-19 last spring. Shauna and her son recovered, but tragically, Otis did not, and he succumbed to the virus in April. I asked Shauna to join us today and to share her story with all of you. She graciously agreed to speak to you in hopes of preventing someone else's tragedy. So with that, I'd like to turn it over to Shauna.
Hi. Thank you, Governor Pritzker. Can you hear me?
We can.
Awesome. Thank you for inviting me to join today's share my family story with you guys. My name is Shauna Seegers, and I am a lifelong Illinoisan. In March of this year, my family and my husband, we were affected by the COVID-19 virus. It started with my son and my husband, both truck drivers. I don't know exactly how we contracted it. I just know that we did get it. One of the things that back in the early part of the COVID illness, we began to feel ill, and a couple of days later, I began to feel ill as well. Okay, at the same time, we think that my son was sick as well. We went to the U of I and we got tested, and they confirmed that my husband and myself had the illness. We actually began quarantining ourselves prior to being diagnosed. However, after the diagnosis, we began being vigilant about changing the sheets, making sure no one entered our house, making sure that we did not go any place. My brother and my sister, they began to go shopping for us. They began to drop things off at the door, food outside the door, and they would do the ding dong ditch and run and go back to the car. One of the things that we were able to do is that we were able to quarantine ourselves so no one else got it. But both Otis and I was having a hard time. Otis a little bit more difficult than I did. And we went back to the hospital. That particular day, which was March 28th, they told me I could go home. But my husband had to stay. That was the last time I saw him alive. They began to give him oxygen, but it wasn't enough. On March 30th, they told us that they had to intubate him, and his oxygen level was dropping lower and lower. Otis never recovered, and on April 25th, Otis passed away. Since that time, every day has been a challenge, focusing on new memories and how to live without our loved ones in this ongoing difficult time, especially during the holidays as it gets closer to this time of year. It's going to be difficult for my family. It's going to be difficult for my children. I do want to say that I don't want any other family to experience losing the pain that my family experienced. So please, please, please follow the guidance of Governor Pritzker and the IDPH. Stay at home as much as possible. Wear your mask, wash your hands, and please try not to hang with people that you don't know. As a matter of fact, don't hang with people that you don't know. This COVID-19 virus is impacting people's lives. I'm partnering with friends and family so that we can make sure that it doesn't affect people like it affected us. And around this time of year, people are struggling from the virus. Anyone that's struggling financially and they experience a loss from the virus, we want to actually help them out. On December 11th, we're going to be at the Creek Park District accepting donations because we want to be an assistance to families, accepting non-perishable food, toys, and accepting donations via check. If you're able to drop that donation off, we'll be there from 5 p.m. to 9 p.m. And since today is Giving Tuesday, I would like to encourage everyone to think of a way to give back to your community if you are able. And everyone can support their community. Remember to do this: mask up, wash up, and back up. Thank you, Governor Pritzker, and it's back to you.
Thank you very much, Shauna, and thank you very much for sharing your story and of course, your great loss of your great love, Otis. And you and I spoke about the fact that your son, thank God, recovered, and I know you have other children too, and they so far have been free of the virus. But I think your messaging, your standing up and telling people your story is very, very important. So that people know that they really need to follow the mitigations, that this can be tragic when it gets into a home, when it gets spread among a family, and there's so much that people can do to prevent it, and hearing your story helps teach that to them. So thank you for your willingness to share. And now I'd like to turn it over to Dr. Ezike for today's medical update.
Good afternoon, and thank you, Ms. Shauna, for sharing your story. Happy December. Let me start with the numbers on this first day of December. In the last 24 hours, over 116,000 tests have been reported for a total of 10.6 million COVID-19 tests performed here in the state of Illinois. 12,542 new Illinoisans have been diagnosed with COVID-19 since yesterday, for a total of 738,846 total cases in Illinois. We learned over the last 24 hours of 125 additional lives lost, for a total of 12,403 deaths. Overnight, 5,835 people were reported to be in the hospital with COVID-19. Of those, 1,195 patients were in the ICU, and 721 patients were on ventilators. Some of the questions I frequently get are, what's causing these cases to increase? Or what can prevent hospitals and healthcare workers from being overwhelmed? Well, that's a great question, and the answer to all of those questions is our human behavior. We're seeing cases increase because although so many people are wearing masks and being compliant, there are still many that aren't. So many people made difficult choices to forego Thanksgiving in a traditional way and observe virtual Thanksgivings in the hopes of preventing an ICU Christmas, but many did not. Many people are staying home as much as possible, but others are not. And these actions of moving about and mixing up households do allow the virus to spread more quickly, which means there's more opportunity for more cases. The chances that hospitals and healthcare workers will be overwhelmed could actually be reduced if people would take these actions and be responsible for maintaining them. The state has implemented mitigation measures, and they're in place to help protect people and to limit the transmission of the virus. IDPH has provided guidance to long-term care facilities, to hospitals, to schools, to funeral homes. We've shared information with medical providers, superintendents at schools, and we've tried to directly educate the public on how to reduce spread, and we'll continue to do so. And as this holiday season continues, I ask you what you are going to do. I heard Ms. Shauna remind us that it's Giving Tuesday. You can give the gift of life by taking on some of these simple measures that are not so burdensome. We told you at the outset of this journey, at the beginning of COVID, as we started with the phases, that we would be close to our normal when we got to, quote, phase 5. And that phase 5 was when we had vaccines that were readily available and many people had been vaccinated. Well, we're close. And so we need us all to hang in there for this final stretch. It means that we still have to continue avoiding gatherings. It means that we still have to wear our mask. And don't forget, we have to wear it over our mouth and our nose every time. And we still have to maintain 6 feet of distance. We've been battling this pandemic together since January, and we will continue the fight, but it will take all of us. We can't go to every house to see if people have invited others over from other households. We can't check every business to see if everyone is complying with wearing the mask over both their nose and mouth. But if you choose to dine indoors rather than take it out and pick it up and take it for home, you're not helping the situation. What we can do is ask you to reevaluate your behaviors, take personal responsibility, wear your mask, avoid the gatherings, continue washing your hands. Let's do everything we can because lives are actually at stake. And even if you're not going to get ill, which I don't know how anyone could know that with certainty, but we want to protect those who are very vulnerable and who need our support to get them to phase 5 when we're in a vaccine world, when in a world with a cure, where the dangers won't be as they are at present. The governor is always going to continue this battle. IDPH and I will continue our battle, this race against COVID-19, but we will get to the finish line sooner if we're all working together. Thank you.